Welcome back to Remember Your Meds, Dammit. Today's scheduled chaos is epinephrine because sometimes the heart just needs a good old electrical exorcism. Epinephrine is the oh shit drug of choice, the defibrillator in liquid form, alpha, beta, all of it. It's flipping every switch on the dashboard and flooring it absolutely to hell. If you're in a code blue, you're going to be giving 1 milligram IV push every 3 to 5 minutes. That's the standard until it's not. Until it's just you and the epi and your patient's soul deciding whether or not to ghost you. The mechanism of epinephrine. Alpha 1 clamps down on the vessel, beta 1 kicks the heart in its ass, and beta 2, it does whatever it wants. Bronchodilation, probably, but this isn't a quiz. When it comes to anaphylaxis, it's going to be 0.3 to 0.5 milligrams IM. No time to overthink. Just stab it like your license depends on it, because it probably does. The side effects, you just have tachycardia, severe hypertension, arrhythmias, and death if you're lucky. Chest pain if you're not. Push too much and you might bring them back just in time to kill them again. And make sure that you don't mix these up. The 1 in 1,000 and the 1 in 10,000. One's for IM, the other is for IV. Screw that up and you're not practicing nursing, you're speed running malpractice. Now let's talk a little bit about epi drips. Not for codes, these are post-ROSC profound hypotension shock state drugs where dopamine is a joke and Levophed ain't cutting it. Dosage, you're starting at 0.01 to 0.05 micrograms per kilogram per minute. Titrate up as needed. The max is around 1 micrograms per kilogram per minute if you're running out of options or morals. This is hitting all the mechanisms: vasoconstriction, inotropy, chronotropy, but it is slow motion. It's pretty much like giving your patient caffeine and CPR in one drip. On the monitor, we're watching MAP, heart rhythm, lactic, limbs, everything, because this drip can buy time or melt everything from the inside. In a pinch, start it through a peripheral, but you're always going to want this through a central line. Because remember, epi doesn't save lives. It gives you one more shot to fake control before the silence hits and everyone pretends it wasn't enough. The class is sympathomimetic, alpha and beta agonists. During cardiac arrest, 1 milligram IV every 3 to 5 minutes and 0.3 to 0.05 milligrams IM for anaphylaxis. IV drip is 0.01 to 0.05 micrograms per kilogram per minute, and you're watching for tachyarrhythmias, hypertensive crisis, and limb ischemia. Remember, don't confuse the 1 in 1,000 and 1 in 10,000 unless you want your career to be in prison healthcare. This has been Remember Your Meds, Dammit. If you're not shaking from caffeine, trauma, or epi, give it 5 minutes.